So as you heard me talk about in our PowerPoint, it's really important to mark out your patient for so many reasons. As you heard me say, it's very common for technicians to not mark out their patients, and then when you lay your patient down, and we're going to talk about positioning in our next video, but when you lay your patient down, everything changes. So I can just assume I'm treating her love handles or her outer thighs, but when she lays down, I don't know if that outer thigh peak is more to the back or more to the front. I don't know exactly where her main area of concern is once she lies down. So we've got to mark her out and get her approval on the areas that we're going to treat so that we know every single time we're treating the area that she's most concerned about. So with our beautiful model today, the only area that really is pretty obvious is the front abdomen. But usually when treating the front abdomen, we're not treating all the way out to the love handles. That's a different area. So the front abdomen, you find that natural contour, the line on either side where the abdomen naturally feathers out to where the love handles would be. And then how low do we need to treat? So in this case, treating right to the pubic bone would be the most effective for our patient. And then usually it's going to be right above, a few inches above the belly button. So this is our patient's main area of concern. But what if we're treating our patient's patient's love handles? We're going to come over to the side and we'll have our patient, what we need to do is we need to squeeze and find out where the love handles actually are. And in order to do that, I'm going to bring these down a little bit. And when you guys do this in your treatment rooms, you need to have your patient in a garment that doesn't cut in. We're doing this for our patient's modesty, of course, but in a garment that doesn't cut in like a disposable bikini. That's a great thing to do this in, okay? But what we want to do is we want to squeeze and find out where the area is that has the most goodness, okay? And for her, as you can see, I'm kind of squeezing a little bit to the back, and like right here we don't have much tissue, right? But if I come right over here, we don't have much tissue here. So if I go right here in the center, you can see the peak is right here. So what we're going to do is we're going to squeeze and we're going to find that peak, and you can usually tell where it feathers off. That's the end of your treatment area. So we're going to put an X right here at the peak, and then we're going to take and we're going to just put tiny dots around the entire treatment area. And then we know exactly where her area of concern is. If we take and we go over to the other love handle though, we might find out that it's in a different spot. Most patients aren't exactly symmetrical. So if we grab on Jamie over here, she actually has quite a bit less tissue over here than she does on the other side. So for her peak's going to be about right there. And you can see again how I find that. It's feathering out so we can find where to put our parameter here. And that's our treatment area. A little bit different than the other side. So if we were to not mark her out, it's probably pretty common that we'd treat too far forward, we'd treat too far back, we wouldn't get her actual treatment area. So let's go ahead and we'll bring these up. And we're gonna talk a little bit about the outer thighs. So I'm just gonna bring these up through here. And everybody's outer thighs are different as well. So first thing I want my patient to do is I want her to turn and face away from me, because what I'm looking for is, again, the peak of her outer thigh. So, and for her, the peak of her outer thigh, I'm looking for that from the back is somewhere about right here. And then I would do the same on the other side. And then I'd have her turn toward me. And I'd see if I agreed there to find the peak, and I'd find that right here, peak of the outer thigh, and then I'd have her turn to the side. So we're right about here, and you can usually, in our beautiful model here, doesn't really have outer thigh concerns, but usually you can naturally see the parameter right around the peak of your treatment area. And then we'd have our model. Is this the area that you're most concerned about?
Yep.
That's perfect. So we make our model agree with us that this is the area that concerns her the most. That way we know, and then we chart that we're treating the exact area that concerns our patient. And then if we go to the inner thigh here, and our patients are always looking for that thigh gap. So on the inner thigh, I'm gonna have her spread her legs just a little bit, and we're gonna grab right there. Patients always love that. And we're gonna find the peak right there, which we can usually naturally see. And now what we're gonna do is we're gonna look for where that peak naturally falls off, which is about right there, okay? And our treatment parameter is gonna be right around that area. So now we know exactly where our concerns are. We do the exact same thing with our patients when their concern is say their upper knee for a little bit of laxity. We would just find where the laxity starts and have our patients agree with us that that's their main area of concern, and this would be our treatment area. But often when we treat laxity, we bring that up a little bit higher because the best way to tighten things up is with going above them and tightening them up that way. And then we get to the arms. The arms are the most difficult place to treat. So for our patient, we want her to bring her arms up. And then what we want her to do, and this is for the back of the arms, for the arm fat. So what we want her to do is we want her to take her hands and we want her to lay them inside, because it's really hard for a patient to create a muscle when their arms are in this position. And then what we're gonna do is we grab the arm right here and we find, again, we're always looking for the peak, the deepest point, if you can see right there, of the bulge, if you will. And we'll have her from the front, we'll mark her out, and then we'll have her turn around. And we'll do the exact same thing, always making the parameter where it just feathers off right there. So that's how we would treat the back of the arms. And then if we look at the front of the arms, go ahead and turn around. Most of our patients that have concerns with the front of the arms are concerned with laxity. So in this case, if our patient brings her arm up like this, then we can't see that laxity anymore. So we actually want them in their natural state, and that's often where we'll see crepiness on our patients, that lax tissue. So you just kind of bring their arm out a little bit, and you can find the parameter of where that crepiness is taking place on the front of their arms. And just kind of a tip for treatment, if you bring your parameter over the area a little bit, you'll get a little bit better tightening, because when I do this, it tightens up. So always when you're treating for concerns of laxity, treat above the area of concern as well, because it tightens up best that way. Okay, so next we'll be talking about how to position our patients to get them the very best results. We'll see you soon.